Hello and welcome once again to another XR for Europe deep dive discussion, in which we host discussions that really get into the details about different topics facing our industry or facing those who work in the industry, and we do that with dedicated professionals. Today, that dedicated professional is Valentino Megale, who's going to be talking to us about Europe's role in the global XR ethics discussion, which is very prominent, has probably always been pretty prominent, but I would say, at least in my space, it's more prominent. It's probably never been more prominent in my space. And Valentino is the president of XRSI Europe, and we're going to talk about what XRSI is and what the Europe part of XRSI is, and again how that contributes to the global discussion. And Valentino is also an entrepreneur and a founder in the medical XR space with Softcare Studios is his startup. So that may come up as we talk about his background and how that informs his views and his activities in the broader ethical discussions. And again, I think I might even say, what is ethical discussions? What is it? Activity? Is it talk? How is it actionalized? And so I'm Michael Barngrover, just to also check that box. I'm the managing director of XR for Europe, and XR for Europe is a pan-European association working to support those across the continent of Europe who are working with extended reality technologies. That could be as researchers, that could be as artists and creatives, as students, that can be as companies, big companies using it, smaller companies who are making those tools for the big companies. And XR for Europe is also a part of two relevant EU-funded projects, XR for Human and Openverse, which are both very relevant to this discussion, because those are both funded projects to scope out different dimensions of ethics and human-centered values and European values, and XR for Europe is a partner in both, and so that's going to come up in the discussion too. But I'd like to invite Valentino to fill in some of the context and the gaps with that very brief introduction, and maybe first tell us a little bit about what was your journey to XR? What did you start off with it, or you came to it through another career path?
Exactly. Hello, everyone. And hello, Michael. Thanks again for the invitation. I'm really happy to be here and share a little bit of what I'm doing and what we are doing, especially with the XRSI Europe. So, as you said before, I'm at the core of my activity. I really started back in 2016, more or less, with my colleagues, founding Softcare Studios, dedicating myself and our team's work to applying virtual reality in the domain of healthcare. So we started exploring this is one of the most challenging industries out there. We understood that there is a possibility to improve the experience of patients in the hospitals. So what about using virtual reality to let patients go beyond the walls of the hospital? And by this also providing a lot of benefits in terms of reduction of drug administration, medical training, and so on. This is a long journey. It's already the 7th year or the 8th year, we can say. We are active mainly in Italy. And back during the pandemic, of course, during the pandemic was this kind of benchmark condition for all of us. We all shared those challenges. I get in touch with the XRSI, with the global XRSI. XRSI, the global one, in the original one, is actually based and founded in San Francisco, in the US, by Kavya Perelman, and we can say a great community of subject matter experts that decided to use their expertise at the interface of cybersecurity, emerging technologies applied in different fields, first of all, to inform stakeholders, policymakers, governments, companies, citizens on what could be the risk of emerging technologies. At the very beginning, the focus was, first of all, immersive tech, so XR tech. But the more the time passed, the more it became clear that today we are living in a convergence of technologies. So it is not realistic really to approach XR tech just as a silo of innovation out there. XR is merging with AI, is merging with the new iterations of the web, we can say the Web 3 and many other technologies. So today we are really focused on emerging technologies. So back during the pandemic 2020, 2021, I got in touch with the team, and I just, of course, suggested my contribution, to provide my expertise also in the domain of medical XR. So I started there as an advisor of Medical XR Council. Then I became also lead of the Child Safety Initiative. Also, thanks to all the experience that I matured with my company, where we are really focused also on pediatric patients. And so it was a journey of 3-4 years. As we said before, the first goal is to inform, then to potentially summarize, synthesize all of this kind of knowledge about the risks into actionable reports, materials, and the new frameworks that policymakers, companies can use to responsibly innovate in their relevant domains. And of course, it means also collaborating with governments. It means collaborating with global partners and advising policymakers. So this is something that we are doing on the several programs. And then came also ExcelSI Europe. So this is the really latest chapter in the process, because there are many of us advisors or members of the ExcelSI that were from Europe. I'm from Italy. There are my colleagues, Luis Bravo Martins, for example, from Portugal, Alina Kalupski from Germany, Oliver Dada, for example, from Italy. Once again, also Andrea Panero from Italy. And there are many of us, also some of our advisors. I will be happy also to share more later. So we understood altogether that, well, if we want to inform policymakers and if we want to really spread best practices, frameworks, and approaches to use responsibly these technologies in Europe, what we need is a language that resonates with Europe. It means having values that resonate with the values of the European ecosystem. So there are very specific kind of elements of the European ecosystem that cannot be addressed with just a general global overview. We need an iteration of the ExcelSI. And this is why back in officially in the 2021, and now officially launched also in 2024, we registered the ExcelSI Europe, which is a European registered organization, NGO. So we started officially our activities here in the European ecosystem. When I say Europe, I mean not only European Union, but also, for example, UK and liminal areas, because it's, of course, not exactly, we could say, a borderless area. No, it's more than European Union.
Mm-hmm. I mean, an XR for Europe is falls into that same category. That it's we say continental, but even continental is sometimes not the most satisfying term, because we have transnational or transcontinental countries on the continent as well. But also, I would say that Europe is at least an idea that certainly is engaged and a stakeholder with many other parts of Europe for reasons of history, for reasons of immigration and exchange. And, there's no region that's able to be very distinct on its own. And I think that's maybe a good way to get into how does that influence discussions of ethics? Because as you kind of highlighted, you led into, there were some discussions, perhaps some language that needed to be localized. But does that necessarily mean that ethics is localized? Because that would apply perhaps a geographic or cultural relativism to ethics, which I think is not to discount that, but that's a practical, maybe a question for some people as to whether localization is about the engagement, the communication, dissemination, the development, or is it more than that even?
Yeah, definitely. One of the problems that we all spot very often is, first of all, the biggest challenge for ethics is that there is not a universal ethics, unfortunately. Unfortunately. So it means that still, I would say, in a very ambitious way, that still as a humanity, we don't share a universal, we can say, hierarchy of ethics values. which means that, yes, from geographies to geographies, the values, the ethical value that we want that the different societies wants to preserve is different, which means that local discussions, they matter, because when you engage with local authorities, local policymakers, local communities, local individuals, you are able to provide, and you need to provide, all the nuances and the subtle meanings and the facets of ethics that really resonate with them. What we want to make to improve a society in a specific region maybe is not resonating with another one. And at the end of the day, in the ethics especially when we talk about the application of emerging technology, I would say societies, individuals and communities, they should dominate the narrative. We cannot just say this is exactly how we need to apply technologies and this should be the same for everybody. This is a process that should be not from the top down, but it should be really emerging from the awareness, from the understanding, from the real problems of people. Because let me make an example. Even in a company, in any kind of business, if the management team decides to integrate or add any kind of artificial intelligence or VR technology for the human resources management, that kind of technology is going to impact the entire, we can say, professional life of employees in the company. And they should have a voice in highlighting what they are scared from, what they fear, and what could be the critical issues they want to avoid. So yes, maybe the management teams understand that kind of tool is an effective one, is a great opportunity to stay more competitive, to improve the productivity and so on. But this kind of addition should, of course, be informed by the feedback and the voice of who is really impacted by technology. And it's something that, of course, is happening at every level in society. Let's think about XR applied in every kind of field, even just in entertainment. What does it mean spreading entertainment in VR to any kind of segment of the population, included children, included youngsters? What does it mean? What people really fear? What could be the real risk of them? Let's think about AI spread in several parts of the population and potentially threatening also, the job market, the job transition of the population. So ethics, I think, at the very beginning is composed by two kind of activities: questioning technology and listening people. And there could not be ethics if we are not able to listen what people are really scared of, and we cannot really apply ethics if we don't question technology. These are the two extremes of the process.
Well, and that's, I think that's quite fascinating, because you said two, but the third one would be to answer the question. But
sure.
but the question is that actually, is that really part of the process? There's an expectation that there's a question and I listen, and then an answers come. But does an answer emerge, or is an answer delivered? Right. Then it talks. I think it kind of suggests the role of authority in this, right? Because if the answer is there, it suggests some type of authority rather than we just agree. Yeah. But it's emergent, right? Or consensus. So, but I think that's very nuanced. But it drew my attention to the nuance was that lack of that perhaps assumed, defining answer that comes. So maybe I'll ask: is it like an endless cycle of question and listen, question and listen, but you're not necessarily answering?
From my perspective, and for example, organizations such as the XRSI Europe, we can potentially suggest a solution, but at the end of the day, within the fabric of society, this is not our role to generate suggestion, the solution. The solution are something resulting from policymakers, from regulators, from lawmakers. So the role of, for example, XRSI Europe is to question as much as possible technologies in order to identify, in many times, also risks, especially risks that still don't have a name. There are a lot of risks out there connected with emerging technologies that are so much exotic that they still don't have a name. So the goal of subject matter experts and the goal of our network of expertise is to really identify those problems. Once these problems are identified, once these problems are published, we can say for the public debate, I think that the question itself is a call for responsibility.
Mhm.
Because if you as a policymaker, for example, you see that there is that problem and you are not making something, well, there is a huge responsibility. No, because the issue is there, is clear, is defined. There could be potentially countermeasures, but at the end of the day, countermeasures should be created by policymakers. So I think, yes, that the first point that you said is the final part of the loop that is not dependent from us, but that can be triggered by us.
Yeah. And bringing up the role of a policymaker, as being this other entity and a part of it. And you also mentioned defining the risks, so that policymakers then need to address it, because it at least has been made intangible in some sense. But that also highlights something that came up in that I don't have an ethics background very much, more than everyone who has an engagement with ethics. But in the XR for Human project, it is coordinated by researchers from the University of Southeastern Norway and University of Oslo, and ethicists there are working on these topics, part of that project. And one of the researchers made it a distinction between defining ethics in the context of risks, or overemphasizing risks as a concept, because it does kind of frame, right, looking at it as the perspective is different. Than you start looking at the positives, the social value and benefits, which is also ethical, but it's not, the focus is on the other side of it. So I guess I'd say that, bring it up to ask you a little bit of how you see the role of maybe XRSI and when it engages with policy makers, because I think perhaps policymakers by nature are looking to, they have a risk orientation, because that's perhaps more the role of regulation. But that's one aspect of the discussion, right? There's the positives, but then the positives maybe the regulation doesn't engage with defining the benefits of it or something. So how do you see the way in focusing on risks when you in the work that you do with policy versus focusing on the social impact and benefits?
Well, actually, we see risks, so identification of risk, as a preliminary step to potentially extend the benefits of a technology. This is something that comes very strong when it comes for children, for example. Like even children and the youngsters, they have the right to access the many potential of new technologies. Now, because beyond the risk, new technologies for children, for communities, also for youngsters, they represent a great opportunity to get in connection with a peer, learn, educate, and so on. So we really can access the benefits of new technologies if we identify risks and try to potentially prevent and minimize them. In that case, the benefits grow. So at the XRSI, and in this case, I'm talking about the XRSI Global, also when visiting the website of the XRSI, xrsi.org, what we find already is a new version, for example, the privacy and safety framework. We already work on that. There is an open, we can say, framework available to everybody when it comes for really understanding what are the risks of emerging technologies and what you can do to potentially do two things: prevent and potentially manage. In our vision of the framework, we start with identification of the risk, then informing policymakers and all the stakeholders, not only policymakers, about the risks. And then there are two steps: prevention. And prevention, once again, is very strong and very meaningful in the case of children, because in children, any kind of, we can say, a risk and issue can have a long-lasting, we can say, impact, more than in adults. So it's even more important in children to prevent any kind of risk. So you need to understand how to prevent so that nothing will happen. And at the same time, at the end, you need to have controls and we can say strategies to manage the risk and the issue when it occurs, basically in a specific kind of domain. So we break down this, the risk management and the risk assessment through these 4 steps, okay? And this is something that we matured organizing tailored thematic roundtable, not only with the internal network of experts in the XRSI, but especially, of course, inviting subject matter experts from educators, families and parents, policymakers, companies, and of course, and also industrial partners, because all of them can say something not only about the risk, but about the feasibility of managing the risk and the best practices to do that. Because whenever we are introducing a strategy in a society, the society is intertwined jungles of many kind of stakeholders. So we can preserve one and we can damage potentially others. So it's really important to understand what are the strategies that are the best, we can say, sustainable and responsible trade-off between the different kind of parties. And this is really important. So we start by what is really important not is only identifying the risk, but also converting this identification into practical, actionable controls. Tomorrow, when something like that happens, what I can do to manage that kind of risk. Of course, as I say, this is still not the final solution, because if the final solution it's not converted into law or a policy, well, it's still voluntarily. No, it's still something that maybe company can just follow because they like the mission or this resonates with their mission. But this kind of actionability is something that, in our opinion, facilitates the work of policymakers and can convert potentially in laws that can be enforced. It's totally different kind of process.
Mm-hmm. That's a good segue to ask in some detail, like the kind of activities that you engage in to generate those reports, the types of consultations that you facilitate. I want to just highlight that we have a question in the chat. We'll get to in just a second, because and so you definitely, if you're listening to us live, feel free to pop your questions into the comments, and we'll get to them. What was it? I just asked the question. I forgot what I just said to you about it. But do you remember what I just said before?
You said about what is the process through which we produce this kind of knowledge?
Yeah. So are you organizing? Do you collaborate with other, I guess, with partners to maybe bring people together for consultations? Do you do surveys and interviews? What are the types of activities?
Of course, surveys for sure. We make different kind of even focus group. For us, roundtables are like extended or sometimes public focus groups when we can work together on specific challenge, specific issues. We can discuss exactly what does mean. I want to make the example of the great activity also of the Child Safety Initiative. Because in that case, we are involving partners like UNICEF or a lot of psychologists, therapeutic specialists, gaming companies. All of them can say something about what does mean providing an innovative service to children and youngsters, but also what does mean providing this in a responsible way. Because even if a company, let me make an example, even if a private company, a gaming company wants to be responsible in that domain, it's not only a matter of I want to be responsible. It's also a matter of understanding what does mean being responsible in that area. Yeah. And sometimes developers or sometimes the management teams or general speaking teams of gaming companies, they lack some vertical experience in regulation, policymaking, and so on. So the role of an organization like ours is, for example, bridging those who have the responsibility. Maybe they have some lack of understanding in order to enforce this responsibility, and connecting with subject matter experts like academics, researchers that have a lot of knowledge, but sometimes that knowledge is not applied in the practical products on the market. Yes. That is something, at the end of the day, it's a shared responsibility. It's a shared responsibility in which everybody can just play a little role to provide a universal, we can say, more or less, safety.
Well, and that brings me to an example from the XR for Human project. Well, one of the outputs, one of the core deliverables in the end of that EU-funded project is a code of conduct for ethical and value-centric development of virtual worlds and XR things. And in the research, in the discussion, not in the research, but in the formulating, it's the first question is, for whom is the code of conduct, or where is the code of conduct engaged? Who's going to engage it and when in this long process of ideating it, making it, distributing it, iterating it, all these different steps. And of course, the reality is that there should be many codes of conduct because there's so many different decision makers. And so, one of our roles in XR for Human is to kind of help bridge between the work of researchers and policy experts with industry, representatives. And in some cases, I'm also hearkening back to my background as an independent developer, thinking of, well, who made the decision about a particular design, or, whether this was the right, most accessible, and it was not, the thinking is the developers are the ones making it, but oftentimes the developers are working under direction and guidance that is not theirs. The designer even is not always that person. It's a project manager. It's a client. I can definitely speak to examples where, I can tell a client that's not going to work. It's going to be confusing and disorienting, or in some cases with an artist, that's going to be nauseating. Do not do it. But there's a limit, right? There are things where it's like, I won't do that. As a developer, I'm not going to do that because I won't put my name associated with that. But in other cases, it's like, it's not going to work. It's not going to be good. It's going to be confusing. Some people won't be able to use what it is you're asking me to make for you, but you say, oh, it's, at the end of the day, this is your project, but it's not going to, so as an example of me transitioning responsibility about something that I feel like is not harmful, it's just not accessible.
Yeah.
But I'm defining it as not harmful, but I'm choosing to define the lack of access as somehow, not harmful. So, there are all these decisions, but it's really hard, I think, to define, as you said, this web of responsibility and decision making.
And as I said before, it's the great challenge is to define this kind of trade-off, that makes sense for all of those people. I want also to share the experience that we have in the hospitals. Of course, when you are implying or you are applying, you are introducing new technologies to improve the experience of patients. This is, we can say intuitively, the best case scenario. No, you are improving the experience of patients, but we know that within the hospital, experience of patients should somehow be connected with also the sustainability of the operations in the hospital, in the time availability of physicians and nurses. So whatever you introduce with the best intentions, still it should be able to speak the languages of those other many stakeholders.
Yeah.
So
compromise.
Exactly. At the end of the day, the great challenge is how to make ethics something that at the same time makes sense to everybody beyond its vision, but because it is sustainable, because it's something that for a company is also positive to embrace. Let's think about the social corporate responsibility in many companies today. This should become the rule for the many companies that are designing XR or XR plus AI solutions. So this is a great challenge of education, awareness, but also how to integrate these nice topics into the fabric of society. This is the big challenge. Of course, policy and laws can simplify this process, because if there is a law, of course, you need to be compliant. But I think that at the end, it should not be only laws, because it would slow down all of the process. It should be a good balance between regulation, official regulation, and some conduct, as you say, that is shared by the people.
Well, I think that's important, right? Because the thing is, you can look at laws, but laws become like a pillar.
Exactly.
People can go around the pillar. The law is there. They didn't violate it, but they definitely, found their way around it. So what we're looking for is adoption, is respect and adoption for the spirit of a regulation or a law, and that's right. That's a continuous challenge of continuing to reinforce that internalized acceptance and adoption. I do want to get to the question that we had, because it's been up there for a little while. So this comes from someone from Italy. Federico
Anselmi, yes,
exactly, from Federico Anselmi, who asks, given the rapid advancement and integration of XR technologies in medical diagnostics and treatment, what are the most significant challenges in ensuring patient safety and data protection? And obviously, you've heard probably these questions a lot in your entrepreneurship side of your day. But yeah, how do you respond or address that topic?
Yeah. Oh, that's a great question. That makes sense. It's when we talk about the application of XR technologies in healthcare, we still talk about the very borderline situation between digital health and digital therapeutics. So it's the step when digital health starts really gaining clinical evidences, clinical data, research, and potentially validation and certification. So the biggest problem in that case is that there are many research studies around this kind of applications and technologies. And probably this is something that we discussed also in the last years, also in Rotterdam, in other meetings. The problem is that there is still not a standard and shared way of approaching clinical studies in this domain. We are towards a good direction. We are embracing interesting and useful roads. But the many studies, the many pilot studies, they are still not always speaking the same protocols, the same standards. What does it mean? It's when a physician or when hospitals, they want to introduce this kind of technology within the hospital, they don't have one single framework to evaluate the safety and the feasibility and the effectiveness of those kind of solutions. So sometimes the decision can be not completely informed. And in that case, this is the first loophole to potentially put at risk patient safety, because you are not totally aware about what kind of technology and what technology can really do to patients, and about data protection. Data protection means also cybersecurity in healthcare. And unfortunately, to date, healthcare is the most expensive and most targeted industry when it comes for cybersecurity. Because in many countries, healthcare is not by design the safest industry. There are many loopholes because it depends from the funding, it depends from the awareness of different hospitals. So many very profitable data of patients are quite easily exposed. And this means that if we are adding a new attack surface, which is virtual reality and all the data that can be collected with virtual reality, we are adding that to a domain that has many cybersecurity threats. We are seeing many ransomware attacks in many hospitals around the world, because it's easier to attack a hospital than to attack a bank. And maybe in a bank, you are going to steal money, but in a hospital, you are going to steal personal data that you can use to make a lot more money than just with the money that you can steal from a bank. So that is a big problem. So I think it really starts from a standard research that you can use as a standard way to evaluate these technologies first. And then, of course, it means also investing in cybersecurity in the hospitals beyond XR, but it starts with cybersecurity.
I mean, that response brought up just a whole number of different topics to pursue, but I'll pick one to start with. It's this a lot of the discussion with XR, right, is about the new types of data and the new risks.
Yeah. Exactly.
But I think what you just highlighted was actually the way the new data simply, in this case, enhances potentially risks that are already present. And so XR is just kind of like piling just more information on top of already risks. And I wonder, outside of data, if that's also to be honest, I'm going to answer my own question before I ask it, is that I do think that, right, there are some business models that we already kind of identify as being potentially unethical, but they're accepted in other domains, with other digital platforms. But making it virtual reality or making it persistently immersive doesn't change. Something we've already accepted as we don't like it, but it's there because some people in society defend it successfully. But the risk presented simply appears a lot more impactful when it's made immersive. I wonder the role of your perspective, but also from XRSI's, because you guys focus on emerging technology more broadly than a particular one. But like, how do you, at the convergence of it, I guess, split the focus between, or not just the focus, but I guess maybe in conversation, the nuance between XR maybe in some cases not adding significantly new risks, but simply highlighting existing risks that for some reason we simply tolerate as a
Yeah.
society. But XR gives us an opportunity to say, should we be tolerating it? If it's not okay here, why is it okay without a headset or without
Yeah.
immersion?
I want to make a connection with this. One of the topics that is very important in our work at DXRSI is the topic of biometrically inferred data. So if we consider, for example, eye tracking, the eye trackers that are right now embedded in many headsets, more than in the past. We can say the Apple Vision Pro, we can say the Meta Quest Pro, and then also the future ones. The problem is this, that in many cases, people can see, okay, the company is asking for my consent to provide the tracking data about how I move my eyes. And it's okay.
Yeah.
This is something intuitive. And many people will say, okay, this is why, this is because I need to control the interaction with the applications. Or this is, for example, because the company is truly interested for digital marketing purposes to understand what is interesting to me and potentially provide me a personalized content, which is still good until it is clear. Okay, we all like the personalized content, and many times we really say, yes, I provided the data because at the end, when I enter in the e-commerce, I want to spot exactly what I want to buy. But the problem is that you gave the consent to raw data, but from those raw data, you can potentially infer much more sensitive data about the individual. So mental state, cognitive disorders, and many other kind of conditions. If a company knows this kind of data, you are not sure and you don't have the certainty how this data will be used. If you're, for example, a big corporate that is using XR technologies for the onboarding of the personnel, for the training of personnel, which is an amazing way to make remote the learning by doing. Yes, but if the company collects data about you and they discover that maybe you are going to develop, I don't know, Parkinson or Alzheimer in the next 5 years or 10 years because you collected digital biomarkers, how sure are you that the company is not considering those data to potentially fire you? So we, in many cases, this kind of loop, it's still not included in the policy, but also in the understanding of people when they are using these technologies. And this can be a risk. No, so these technologies, they need to collect data because otherwise they could not work. And they can collect a lot of interesting data that can generate a lot of value in healthcare, but in this kind of domains, they can represent a risk. So, it's okay for us, for example, sharing so many data to an e-commerce. And still, an e-commerce cannot really understand exactly that we are developing a neurodegenerative disorder. But this can be spotted if we are, for example, playing in a video game. And what about an insurance company using those data to potentially refuse us an insurance? So this creates just a new level of threats. I just want to make a final example that I heard a few weeks ago about a person in the US, probably, who
probably the US.
No,
I'm expecting it to be something terrible.
No, because he was actually having a, driving an autonomous car, almost autonomous car, and he was asked by the insurance to pay a higher fee because he never did an accident, but the data collected by his driving, habits show that he was driving in a very, risky way.
Yeah.
So the insurance just asked to increase the fee. It's just like a sort of minority report, in the in the driving of a car.
But I would ask you, in that specific scenario, this is I think a rich one. Let's kind of break it down to how do you look at the ethical aspects of this particular context? A simple one, but how would you assess it? And the reason I bring this up is because there are two projects that I've mentioned before: XR for Human and Openverse. And in both cases, in specific contexts, this is not a good example of what they're trying to assess, but there's efforts to create a rating system, an evaluation system that can be informative to to potential audiences or users or consumers that this particular application or this metaverse platform, this virtual worlds platform is either accessible or ethical or safe, or these types of questions. And it's obviously it's rather challenging, I would say. I'm not deeply engaged in those efforts, but I observe them, and I observe the feedback. It's a complicated effort. So in this particular example, someone who had their driving assessed automatedly, I guess the practical question is, one issue is, one, did they know that their data was being collected for evaluation? That's one element. And if not, okay, that's unethical. But let's say that they did. They said, okay, that's cool. You're evaluating my driving because you want to give me feedback, but possibly, cool. But I guess then the question is, if someone else is giving me feedback, yes, the car company is giving me feedback because they're the ones who's giving it. Okay. But if the insurance company is giving me feedback, that's an ethical dimension. But I guess from the insurance company's perspective, or even from the car maker's perspective, if I identify that this person is engaging in unsafe behavior, which presents a risk to the public, and I guess that's what, I mean.
Yes, you touched different fundamental points. So if I remember well, this kind of news came to the news, actually, to the internet, because that person didn't know about the possibility for its data to be collected and used for these purposes. And I think this is the most interesting part from the ethical analysis, no? Because if that person didn't know, well, it is totally okay that if someone is engaging in risky, unsafe behavior, this should be stopped somehow. This is exactly why we stop people who are driving too fast. This is still predictive, because we don't know that people to potentially hit some people later in the road. So first of all, if the person knows that, well, there are many other kind of reflections that we can do, because we need to understand who are the stakeholders involved in this. There is the driver, there is the car maker, there is the insurance, there are the potential people that can become victim of this unsafe behavior. So of course, in the final evaluation, we should make the good trade-off. I think that the insurance can, we can say, provide this kind of service only if the car automaker is providing those data. So this is a service that the insurance can live only with the data provided by the car automaker. So the car automaker is just providing data that can be used also to evaluate the safety or not of the way of driving. And I think until it's like this, it's perfectly, we can say, ethical. No, but the real problem at the beginning is that was a surprise for that person. So the potential situations are this: he was not informed about this kind of possibility, and we should be always. Maybe the communication was not plain. Maybe the communication from the insurance was very complex, and at the end of the day, there was communication, but it was not effective. And we come back also to the discussion that makes a lot of sense also in the domain of healthcare, of plain language. Plain language should be something that is not superficial, but it makes accessible the complexity of technology and its risks. And I think that organizations like ours, we are working on that. To make this complexity more understandable, because if people don't understand it, there is no risk assessment that is really useful for society.
I mean, there's that question about comprehension, which is about the simplicity of the language, the timeliness of it, but also I think to some extent there's also the expectation, the assumption of willingness to understand. And I bring this up because I have a little bit of background, because my family was in medicine. So I worked in medical offices, and, every now and then I think you encounter someone who says, "Doctor, I don't want to know." So in this sense, it's like, okay, well, that's right. You have the right. I don't agree, but you have the right for me not to provide you an assessment or an evaluation or a diagnosis. That is your right. Your family members may contribute, but, to wanting to know. But if you don't want to know, and you don't want them to know, then, but it becomes, quite an area for a doctor to or a medical professional, and there are non-medical opportunities we can look at. But coming into like this, right? If you do these assessments because you have this data, let's say, for example, there's the consent to be assessed for one particular issue, but the process can identify others. I guess to what extent? And obviously, it's a conversation, right? That there's not an answer to this. It's really just, but I can I can imagine that there are going to be diagnoses that someone's going to say, "I'm so glad that this process discovered something unanticipated. Was not looked for. It's going to give me advance notice, or I can make decisions based off of it." But then I can imagine people saying, "I didn't want to know that. I don't want to have to make a decision about that."
Absolutely. It's in the GDPR in Europe, there is the purposeful collection of data. Now, so whenever a company is collecting data, they should highlight exactly what is the purpose, and they should minimize the collection of data only to that purpose.
Yeah.
I think that the more we can advance, the more we are advancing, the more we'll be able to find out information that we don't know, we don't want to know, especially when it comes for healthcare. Think about all of the BCIs. Think about the possibility to scan brain data with the next generation of headsets. We can really spot many things there, but it shouldn't convert immediately into I'm sharing those data with you and making you know anything about your potential risk and so on. So I think that this is a huge debate that should be done also by policymakers, but also with people. Actually,
it's a societal question, I think. Yeah, it's part of the civil, because in some sense you'd say, well, we have a social security.
Yeah.
If there's a preventative action that can be taken that would lower my burden on the social security, but wait, but why should why should a policymaker or a manager of these processes be looking to limit my burden on society?
Exactly.
Shouldn't I have the right to be the burden that I choose to be in some sense, in one way? But clearly that's a
huge one. That's a complex one. Let's imagine this: that maybe a big company has the possibility to collect very personal data from the employees, and maybe by using XR, it's collecting a lot of potential hints, still, once again, of neurodegeneration in the future. Maybe they see that there is this kind of spike of many people potentially having this kind of conditions in the future. So from my perspective, for example, with very perspective, maybe that company, instead of sharing those data with the employees, they should invest more in preventive actions. Like you can have a discount to potentially make a lot of controls to check up and potentially, increase the possibility for you to take care of your healthcare. But, this kind of statistics, exactly, this kind of statistics should not pass directly from the company to the employees, but should convert into healthcare initiatives by the healthcare system. This could be an interesting one.
Yeah.
Just a perspective on the topic that is not bad by design. It could be bad how this kind of data can be immediately used with no strategy.
Yeah. Well, and I think, we're highlighting that, right, we don't know yet what we can know. I mean, and by we, it's not that no one knows, but broadly speaking, a lot of people do not know. And I think it's always been the case with those who collect data. There's a hoarding aspect, right? It might be valuable. It's not valuable to me now, but it might be. And I think that was encouraged for a time, particularly in some markets, maybe more than other markets. That was kind of encouraged, and that creates its own unknowns, because how well prepared or how clean was that data? And of course, what's wrong? What happens when data is incorrect? Like, how do you? But I'd like to kind of switch a little bit, just for the time that we have, to maybe not a sort of data security perspective, but more of a design question for ethics, because my background academically and in the research side was in the psychology and management and design of multi-use platforms. Okay. So initially, I was very drawn to remote working.
Mhm.
Prior to the pandemic, I was very interested in that, and that seemed natural for because I'm an immigrant. I live in other countries, but but I recognize that the design of a platform fundamentally it frames the way you work with others, the way you engage information. Data
Absolutely.
visualization is very um, guiding and not always very well understood by those who are assessing the
Mhm.
information being presented. But when it got into multi-user and collaboration, and in the pandemic era, when suddenly I could study people trying to work together, right? It becomes even more clear the power of the digital mediator. And Emmy Hine is a researcher. I don't know if you know Emmy Hine. Yeah. So we had her on an earlier discussion, and she's one of the few other people I've encountered who also talks about this fundamental role of the digital mediator in these virtual environments, which
Yes.
don't have to be VR. But for me, the thing that I was looking at before, and I've talked with her as well about, is in a professional context where the company is the controller of the digital mediator. The digital mediator might be the platform or whatever software or something, but the company, in addition to the digital mediator, is an omnipresent element to my reality that's shared with others. And I used to often think about, because I was living in Istanbul, so I started my XR career in a Muslim country at the periphery of Europe, and I was aware of the consequences for many people through international work and collaboration
Yeah.
for that. And also, I was working with Palestinians in the West Bank before living there, and thinking about avatar representation. Everyone wants to be able to be represented the way they want to be represented, but then there are consequences if someone doesn't like your representation. If I was a company, not just the platform, because platforms were kind of implicitly or explicitly making those decisions for users for a long time.
Mhm.
But thinking of when a company starts to say it's important that we have our internationally distributed teams, but we want them to work well together. It's problematic for us when people, the way they identify, the way they appear, the way they speak or their names somehow is creating problems because we have
Yeah.
inherent bias. We're not going to get rid of the bias, but we can certainly make the bias go away through digital mediation. Um, and I can imagine times where, I don't know that it's ever happened intentionally, but it's like, but there's nothing that would stop a company from saying, you can look the way you want to look, but no one else will see you that way.
Yeah. Yeah.
You're happy because you look in the virtual mirror and you look the way you want to look. But don't worry, everyone sees you the way they want to see you.
Mhm.
Um, and thinking that there really isn't a lot of discussion around that fundamental power of the mediator, which has, again, to my knowledge, not been utilized for nefarious purposes and maybe for any purpose. But it seems so obvious on the surface. And I wonder, like, because sometimes we talk about risks that we can see today because
Mhm.
those risks are very obvious. Um, and they're criminalized. But this is an example, isn't criminalized. It's
Yeah.
really something that is, um, it's very possible. And so how do we kind of, how, as XRSI, how do you, right? You're forward thinking and you're thinking of future scenarios, but
Yeah.
perhaps this is even more future because it's possible, but just no one is even thinking to do this yet.
No, no, yes, yes, but this is very relevant topic, especially in the workplace. The bias, in my opinion, is a problem until it is invisible or voluntarily made invisible. No,
Mhm.
if you enable people to provide their voice, their personal voice, the bias can be something that we really cannot cancel forever because
Yeah,
bias is part of our brain. Okay, so it's
it's
a
emerging.
cognitive.
It's always iterating. Yeah.
Exactly, it's part of us. We will always have some kind of bias. But if you have the space to talk about the bias and potentially correct the situation, well, this is just a step of improvement. It's an area of improvement and not a problem.
Mhm.
And you say sometimes people feel not represented in a virtual space. In other moments, some companies they deployed virtual spaces because employees felt basically that in virtual space they can be themselves even more than in the workplace because they can
Mhm.
express themselves, they can experiment with themselves, where they can choose any kind of body, so they can finally somehow have this kind of safe zone, or this kind of this safe cover of their body, not exposed to the biases of the employees, and they can focus on information exchange, communication, collaboration instead of being criticized since the beginning. So it really depends on how you are going to use this kind of tools. Of course, it's fundamental to remember that whenever you are in a space, in a virtual space, your brain reacts to what kind of body you embody, at the end. This is one of the amazing opportunities of virtual reality. We can have a body with just one click, a different body with just one click. And many companies, if we say many commercial companies, they are extending the possibility to customize your body, because this was something that was really asked by the community. We want to represent ourselves exactly, or in ways that don't fit exactly in our original body. I think that at the end of the day, the topic is not the problem of the bias, but having the opportunity to talk about the bias. It's we really shift towards the diversity and inclusion topics, when a company that really wants to be inclusive and diverse should provide the space and the safe space to talk about these issues. Because we really cannot think that we can know anything about the risks. And there is no organization, no association, no company, no management team that has a universal understanding of the issues. We can increase our opportunities to know the more we provide voice to the others. So especially when it comes for these problems, until there are channels of communication, we can solve them. If we just cancel the channels of communication, in that moment, many issues can be submerged, by any kind of operations of the company. So this is just a problem that points to the need to communicate.
Yeah. I mean, so you could have so many follow-ups to exactly that skill. It's for me, it's one that I've spent time discussing and thinking about. So always these other elements to it, but conscious of time, because we're nearing the end of our session. I'd like now to kind of ask you. The Europe branch of XRSI is fairly fresh as an official entity. What is in the next 6 months? What is in the next rest of the year that you're going to be engaged in? That and what are the opportunities for those to engage with the XRSI Europe?
Absolutely. So first of all, we have our digital identity as our website online. So you can visit xrsi.eu to really explore what we are doing. We have also our profile on LinkedIn. So what we are going to do is engage in educational information and workshop events, so that we can really put in practice, or we can share our expertise, because we are, first of all, a network of experts. Okay, so we are covering several different expertise, and we are engaging with some new partners, new local communities to share our expertise, focusing on the topics of digital ethics when it comes for emerging technologies. We are going also to join some events, especially in the second half of this year. So just follow us on LinkedIn to potentially meet us physically at these events, or in case of online webinars, to meet us online. And we are definitely accepting any kind of submission as new members of the XRSI Europe, because we are extending our network. So whoever is interested to collaborate with us, whoever wants to just contribute even as an expert, we have a growing also board of advisors, from, for example, Monika Manolova from Bulgaria, to Francesco Pagano in Italy, and also Hanna Lindstall from Sweden. So we have several experts that can provide perspective. Experts provide us perspective, professional perspective, so that our research is not biased, but what we don't know, but is constantly enriched by the professionals out there in the society. So events, information, and collaboration. So in the next 6 months, we are going to work on this. Of course, we expect to potentially submit to grants, to potentially support our activity, but first of all, to connect with many players all around in the Europe.
Great. Well, that's pretty succinct. So I encourage anyone interested in engaging in the broader topic of ethics and ethical usage of different emerging technologies, particularly in the European context, to reach out and plan to attend the events. We didn't name the events, but I'm sure the events that you'll be present at are going to be on your website. And we definitely look forward to, as XR for Europe, engaging with XRSI Europe more in projects like XR for Human and Openverse and others. Sometimes we have our own interests that fall outside the scope of those particular projects. So we certainly look forward to communicating and potentially collaborating more the rest of this year. So I want to thank everyone who stayed with us, who followed the discussion, and everyone who's going to watch this later. Apparently, all the way to the end, since this is the very last part when usually people would be concluding. And look forward to our next events. We've got several more coming up in June that we're going to announce. We actually have one next week, which I'd like to plug, because some of the speakers will be coming from the projects that I mentioned, XR for Human and Openverse, as well as the platform ROM, multi-user platform, and from Less Media, which is a company that organizes many virtual events for many years now. And that discussion is around what makes a virtual world European, kind of building on this broader concept that we're talking about technologies and issues and users, audiences, and companies that are very often global, or at least globally connected, even if they are based in Europe. But is that basis in Europe geographic and physical? Is it conceptual? Is it aspirational? I don't know if we're going to get to those topics in that next session. We didn't talk about them a whole lot today, but this informs this series a little bit as well. So hope to see you guys next week, our audience. And Valentino, thank you very much again for sharing your time and telling us about XRSI Europe. And thank you, everyone, and have a very good weekend. And see you next time.
Thank you. Bye-bye.